Okay, so PA interviews, they can feel like a whole other beast after PA school, right?
Yeah.
It's a lot. But that's why we're diving into this Indeed article today. It's like a cheat sheet for what interviewers are really looking for.
Yeah.
So you can nail it.
I've been on the other side of that table, and it's not just about knowing the medical stuff.
Right.
It's the whole picture. Empathy, communication, thinking on your feet.
Things that don't always show up on a resume.
Exactly.
And this Indeed article starts with a question that seems basic. Why did you choose to work in healthcare? But I feel like there's more to it than just, I like helping people.
Oh, absolutely. It's almost a trick question.
Right.
Because it seems so simple, but it's your chance to connect with them personally.
Yeah.
Show the why behind your passion.
So what makes an answer to that question really memorable? What makes you, like, sit up and take notice?
Honestly, it's the stories.
This story. So
When people share a specific experience that sparked their interest, a moment that solidified their decision to become a PA. Yeah.
maybe even a personal connection to a medical condition that fuels their drive, that kind of authenticity sticks with you.
That makes sense. Everyone loves a good story. It helps you connect,
It does.
like a human, not just another candidate. So if you were in that hot seat, how would you answer that question?
That's a great question for everyone listening to think about.
Yeah.
What are your core values and how do they connect with being a PA?
Yeah.
Because those values will show in your work no matter what.
Okay, so we talked about the why. This Indeed article also has experience-based questions like, tell me about the biggest challenges you've faced in your career. Feels like a trap.
Oh, it can be. We all want to show our best selves.
Right.
But everyone faces challenges. It's how you overcome them that shows your character.
That's what they're looking for.
That's what they're looking for.
So how do you walk that line, talk about a challenge, without making it sound like a failure?
It's all about how you frame it.
Yeah.
Choose a real difficulty, but don't dwell on the negative.
Focus on what you did to address it, what you learned, and how it made you a stronger PA.
So it's not about being perfect. It's about showing you can learn and grow.
Exactly.
This article even gives an example about being a healthcare assistant
Oh, yeah.
and how that helped them develop empathy.
That's a great example. It highlights relevant skills without sounding like a list.
Right.
And it shows you can learn from everything, even the tough stuff.
Okay, let's get into the in-depth questions. The real brain teasers.
Oh, these are my favorites. They go beyond the surface.
Yeah.
You get to show your clinical judgment, how you make decisions, how you handle real-world scenarios.
Okay, this one caught my eye. You're working a night shift and start to think you're too tired to make reliable decisions. What do you do? We've all been there, right? That 3 a.m. brain fog. But seriously, how do you answer that?
That question is all about patient safety and knowing your limits. You have to show you never compromise patient care, even when you're feeling the pressure.
What phrases signal that? What makes them think, okay, this candidate gets it?
Some, like, patient safety is my top priority, and I'd never put a patient at risk. Then outline the steps you'd take.
Okay.
Informing your supervisor, following protocols for fatigue, maybe even asking to be relieved of duty.
You mentioned protocols. That shows you're not just winging it.
Right. You're aware of the guidelines, committed to following them. Incredibly important.
Especially in a hospital.
Absolutely. It's just professionalism, commitment to ethical practice. You're thinking about everyone's safety, not just your own.
Speaking of tough scenarios, this article asks, have you ever disagreed with a physician about a patient's treatment? Tell me how you handled it. That's like walking a tightrope.
It can be, but it's also a chance to show your communication and collaboration skills.
Okay.
Because disagreements happen, especially in healthcare. The key is showing how you handle those differences respectfully and productively.
So how do you talk about disagreeing without sounding like you're undermining the physician?
Focus on the process, not the people. You could say, I value open communication and advocating for my patients. When I had a difference of opinion, I respectfully presented my concerns and evidence-based rationale.
That's a good point about evidence. It shows you're not just being stubborn.
Right.
You're thinking critically, using your knowledge. What if they still don't agree?
You acknowledge the physician has the final say, but you can emphasize your commitment to the patient's well-being. You might say, while I respected the decision, I documented my concerns thoroughly to ensure continuity of care.
That's smart. You're advocating even within your role.
Yes.
Not just following orders, but thinking critically.
Exactly.
Making sure of the best outcome.
Finding that balance between assertiveness and respect, navigating complex situations professionally.
All right, one more question before we move on.
Yeah.
Can you tell me about a time you prioritized the patient to provide them with education about their diagnoses and treatment? What are they getting at here?
This goes straight to patient-centered care, a
Mm-hmm.
core value in healthcare. They want to see that you understand clear, compassionate communication and
Yeah.
that you'll go the extra mile to make sure your patients feel informed and empowered.
So how do you demonstrate that? Show them instead of just telling them.
Share a specific example where you went above and beyond to educate. Maybe you created a visual aid to explain something complex.
I love that.
Or you took extra time to answer all their questions, even if it meant staying late.
Yeah, a concrete example makes it real.
It does.
Like you're painting a picture.
Exactly. And don't forget the impact. Did they express gratitude? Did it ease their anxiety? Those details make your story powerful.
These in-depth questions are really eye-opening. It's like a sneak peek into actually being a PA, dealing with real-world stuff.
They are. And that's why preparation is key. Think about your experiences, your values. Practice articulating your thoughts. That's how you shine.
We've covered some great ground today, from general tips to those tricky experience-based questions. But there's so much more in this Indeed article. Stick with us. We'll be back after a quick break to tackle even more challenging questions and help you craft those standout answers that'll make you a top contender for your dream PA job.
All right, back to these PA interview questions. We've only scratched the surface of what hiring managers are looking for.
It's like they want to see beyond your qualifications.
Exactly. And this next question is a perfect example. What do you think is our hospital's greatest asset? And what should we improve about our hospital?
Oh, wow. It's a double whammy.
Yeah.
They want to know you've done your research,
Yes.
but it can't just be reciting their website. How do you approach that without, like, stepping on toes?
It's about showing you can think critically. Can you identify areas for improvement? Offer solutions.
They're testing your analytical skills.
Exactly. You could start with something positive you genuinely admire, then transition to an area for growth.
Okay, give me an example. How would you phrase that?
Let's say you're impressed by their community outreach. You could say, I was impressed by the hospital's commitment to community healthcare. It aligns with my values. However, I've noticed that wait times in the ER have been a concern. Maybe exploring telehealth or streamlining processes could help.
Ah, you presented a solution. You're not just complaining.
Right. It shows you're engaged, observant, and thinking outside the box.
Okay, here's another one. Give me an example of something you've done in the past to enhance patient security or comfort. Seems like they want something really specific. What kind of examples would impress them?
This is about going above and beyond. Think about times you went beyond the basic requirements to make a patient feel cared for.
Not just following protocols, but using your initiative.
Exactly. Did you advocate for a policy change that improved safety? Or maybe you noticed a patient was anxious and took extra time to explain things.
Cool.
The little things that can have a big impact.
I remember the article had an example where a PA created a document explaining the diagnosis in plain language, like how long the illness lasts, when to seek more help, how to manage symptoms at home.
That's a fantastic example. It shows initiative and dedication to patient education.
Empowering patients to understand their own health.
Yes.
Okay, let's talk about the questions that make everyone squirm. Have you ever experienced burnout? How do you keep a good work-life balance? Those feel like landmines.
I know. They can feel very personal. But these questions are more common now. Healthcare is demanding, and they want to see that you're self-aware and proactive about your well-being.
So how do you answer honestly without raising red flags?
Be honest, but frame it positively. Acknowledge burnout is real, then focus on your strategies for staying healthy.
Mentally and physically.
Yes.
Like what?
Exercise, prioritizing sleep, mindfulness, setting boundaries. Show them you have a plan for taking care of yourself.
So you can be your best for your patients.
Yeah.
It shows you're in it for the long haul.
Right. Okay, ready for another curveball? You're closing the clinic for the day when a parent comes to the door worried their child has a swollen arm. What do?
Oh, well. It's after hours.
Yeah.
But you can't dismiss a concerned parent.
This tests your judgment, your professionalism, balancing empathy with boundaries.
There's no easy answer.
No. What matters is showing your commitment to patient care while following protocols.
So what would you do?
I'd acknowledge their concern. Never dismiss someone, especially about their child. But you also explain the clinic is closed.
Setting boundaries.
Yes. Then I'd offer options: urgent care, the ER, depending on the situation, maybe even contact the on-call physician.
You're showing compassion, but staying within your scope.
Exactly. It's about finding that balance. These are the nuances they're looking for.
These questions are really making me think it's not just about textbook answers. It's about your thought process.
Your values, your ability to handle the unexpected.
What else does this article have?
Oh, plenty more. We'll delve into questions that get to the heart of what it means to be a PA, those essential human skills that go beyond clinical knowledge.
All right, we're back for the final stretch of these PA interview questions. Ready for more?
Let's do it. We've talked about tough scenarios, but there are always more curveballs.
This one caught my eye.
Mm.
You're assessing a patient, but you're struggling to determine their diagnosis. What do you do? It's like they're testing your comfort with uncertainty.
Which is something every healthcare professional faces.
Right.
Medicine isn't always clear-cut. It's not about knowing all the answers immediately, but knowing how to approach things methodically, with the patient's best interest in mind.
So how do you show that in an interview? What makes an answer stand out?
Honesty and humility are key.
Yeah.
Everyone in healthcare knows there will be times when a diagnosis isn't obvious.
Right.
Acknowledging that and showing you're willing to seek help, that's a sign of a strong PA.
So what are some practical steps you could mention?
Reviewing the patient's history thoroughly, considering different diagnoses, ordering more tests, consulting with colleagues or specialists. It's about showing you have a system for problem solving.
And that you're not afraid to ask for help.
Exactly.
But what about the patient? They might be anxious if they sense you're unsure.
That's where communication is so important. Be honest, but reassuring.
Okay.
You could say, I understand this is concerning, and I want you to know I'm committed to figuring this out. I'm going to gather more information and consult with my colleagues to explore all possibilities.
That's good. Transparent, but not alarming.
Right.
Okay, this next question takes a different angle. Tell me what you believe is the most important quality for a physician assistant. It's more philosophical.
It is. But it lets you show your values, what drives you.
What qualities would stand out to you if you were the interviewer?
Compassion, empathy, a genuine desire to help people. Those are fundamental.
Of course.
But also being a strong communicator, a team player, adaptable, committed to lifelong learning. Healthcare is constantly changing. A great PA embraces that.
It's about showing them you're not just in it for the job.
Right. But for the privilege of caring for patients, making a difference.
Okay, last challenge from this article. It asks, tell me about a time you've had to share unfortunate information with a patient or visitor. What's your process?
This is about your emotional intelligence, how you handle sensitive situations.
How do you even talk about that in an interview?
Acknowledge how serious it is and show you have a thoughtful approach. You could say, sharing difficult news is never easy, but it's a responsibility I take very seriously. It's crucial to approach these conversations with empathy, honesty, and a genuine desire to support the patient and their loved ones.
Okay, what else besides that general statement?
Talk about creating a private, comfortable setting,
Yeah.
using clear and compassionate language, giving them time to process, being prepared to answer their questions honestly.
And recognizing everyone processes things differently.
Yes, there's no one-size-fits-all. A skilled PA adapts to each patient.
These questions really get to the heart of being a PA. It's so much more than just clinical knowledge.
You got it. It's about connecting with patients, navigating those tough emotional situations.
We've covered some amazing insights today. We've unpacked these interview questions, given our listeners some tools and confidence.
Remember, preparation is key. Reflect on your experiences, know your strengths, practice talking about how you think, and most importantly, go into those interviews with confidence.
You've got this. To everyone out there on the journey to becoming PAs, best of luck in your interviews. Go back to that Indeed article, practice your answers, and shine bright. Your dream job is out there.